Let me show you this case. This patient underwent a HIFU in 2015 after a PSA very high of 59. It was a large portion of the gland was ablated. Nice result. The PSA goes down to a relatively normal value, but then starts creeping up in June and November of 2017. So then just shortly after that, in December 2017, we run the MR. And here you can see the T2-weighted image. You may or may not pick up where the cancer is. But when we start looking at here, looking at the DWI and the ADC, we can see that there is a focal area that happened to be positive on the DCE early, and we come back and say, okay, there's the cancer. And based on that, what we did was, because it was such a small portion of residual gland after the aggressive HIFU, we went in and Daniel came and, first they did an Axumin PET study. And this was kind of read a little equivocally because they were uncertain about the MR at that time. So they ran this, and here it said, well, the finding is nonspecific, but residual disease is on the differential. Tough interpretation there. So basically, we believed the MR, and Daniel went in and did the truss biopsy here. So here you can see before the needle placement, you can see the susceptibility artifact going through the soft tissue, and that wound up yielding a positive case here. And you can see the results here, not just positive, but look at the results here. 4 plus 4 in one core, 20% of the core, 4 plus 4 in a second core, 30%, and 4 plus 4 in a third core, 50%. This is high-grade significant disease, and this individual went on to radiation therapy, and the patient has done well since then.